Being awake during that surgery was one of the most surreal experiences of my entire life. You're awake for this. So I'm just lying there awake, being like, I would feel kind of embarrassed, but I'm too nervous to feel embarrassed. Hey everyone, I have been taking a 1 month plus break from YouTube because we welcomed baby Maymay into our family at the end of January. I am back today because I wanted to share my birth story and also go over some tips for recovering from a C-section. And I've also gotten a lot of questions about why I had an elective C-section in the first place. So I just wanted to go over that as well. And hopefully this video will be helpful to some other expecting mamas out there who may be trying to make the same decision I did about what type of delivery to opt for, how to recover from a C-section, what to even pack in your hospital bag. That answer has actually changed a lot from before I went into the hospital to actually having gone into the hospital and undergone the surgery. I now have a totally different perspective. So this is going to be a more personal video, and I'm really excited to jump back into YouTube, and let's get into it. Okay, so first things first, why did I decide to have an elective C-section? And before I start, I just want to dispel this myth that one type of delivery is better than the other. I don't like this idea that a vaginal delivery is natural and better than a C-section. Honestly, I think every woman should get to choose how she wants to deliver her baby, and this is a choice she can make with the help of her doctor and her providers. So the reason why I chose personally to have an elective C-section this time was because of my history of delivery with my son 4 years ago. For those of you who don't know, and probably most of you don't know because I didn't have a YouTube channel back then, I delivered my son back in 2019, and I'm a pretty petite person. I'm only 5 feet tall, and he was quite large for my size at over 8 pounds. Even though the laboring process was pretty smooth with him, I ended up with pretty significant injuries from delivering him. Honestly, the postpartum period with my son was traumatic. Like, when I think back on that period, it just feels like a dark time because not only was I dealing with postpartum depression and anxiety being a first-time mom, but also the nanny that we had hired ended up being a really bad personality fit, and that caused me a lot of stress dealing with that conflict in my home. And also, my husband was really busy in his job at the time. He actually went back to work after 2 weeks, working like pretty much all day, every day. All of that compounded with the fact that I was so severely injured from delivering my son that I could not walk normally for 6 weeks. I had to deal with the initial injury where I couldn't walk at all for at least 2 weeks. I was on around-the-clock pain medications. And then when I thought I was getting better at the 4 to 5 week mark, I started having significant pain again with walking and sitting. It turned out that my scar tissue was healing abnormally. So I was growing what's called granulation tissue in all the areas of my injuries. Granulation tissue is this really kind of like beefy red, very vascular, filled with blood vessels, friable, kind of fragile tissue that forms when you're recovering. So it's a type of scar tissue, but it's an abnormal scar tissue that actually needs to be ablated or gotten rid of. So at that point, I had to go back into the clinic, have an extremely painful series of procedures where they then burned off / cut off this scar tissue that was causing me so much pain. And then after that, I had to recover from that procedure. So all in all, I could not really walk. And imagine having a newborn, getting up in the middle of the night every 2 to 3 hours to try to feed this baby when I myself could not walk or sit and was in excruciating pain, compounded with all the hormonal changes, and it really was a very dark time. So I share all of this not to scare anyone off from childbirth, because look, I went through it again 4 years later, probably because I forgot, but because I want to explain why I chose an elective C-section this time. After talking to my doctor and talking to a couple of my OBGYN colleagues and friends, I came to this decision that because I already have pretty weakened tissue and a lot of scar tissue, that there was a high chance that I could be injured again. Even though with the second baby does come out easier, I still did not want to take that chance that I was going to get as injured. And so after weighing all the pros and cons, I decided to go for an elective C-section this time. And again, every woman has a different history, different medical history, different set of traumas. And this was the best decision for me. Your decision may be different based off of your own personal circumstances. So this is something that you should talk to your doctor about, but I'm just explaining why I chose an elective C-section for me this time around. So moving on to the birth story, I was scheduled for a C-section at 9:30 a.m. in the morning. And so prep started the night before when I took a shower with chlorhexidine, which is an antimicrobial body wash. And you have to smear it all over your body and then stand there for 5 minutes before washing it off. And you can't put on any lotion or moisturizer afterwards. And then you do it all again the next morning before the surgery. So I took these 2 showers. I was feeling pretty anxious. My surgery was at 9:30, but I woke up at 3 a.m. that morning just with nerves. I couldn't sleep. I've never had surgery before. So I was really, really nervous. And the fact that I was going to be awake for this surgery, oh my gosh, that freaked me out the most. So we got to the hospital around 7:30 a.m. They gave me chlorhexidine wipes to kind of wipe down my whole body, 1 wipe for each separate area of the body. And this was all written on a diagram. And I changed into the hospital gown, and that's when all the prep started. They put in the IVs, they started giving me the medications, and that's when I met with my anesthesiologist, I met with my OBGYN, and then my nurse team that would be with me in the OR. And around 9:30, I was wheeled back into the operating room. And let me tell you, being awake during that surgery was one of the most surreal experiences of my entire life. I was just there on the operating table, fully awake. I mean, I climbed onto the operating table myself, and then that's when the anesthesiologist put my spinal anesthesia in. It really did feel like a pinch. There were maybe 2 moments where I felt sharp pain in my lower back as he was injecting the medication. But then right after he injected the medication, he lied me back. And you know that feeling when you've been in one position for too long and your leg or your arm feels asleep? It felt like that, like tingly, falling asleep kind of feeling, but all over my entire body. Pretty much from like this level downwards to the tips of my toes. Everything just felt tingly and heavy, and it happened very quickly. And I will say being a patient is so humbling because you're lying there on the table. Your hospital gown's like pushed up to above your abdomen, like right below your chest line. So you're just like naked, lying on this operating table. The whole team is in there, you know, my male anesthesiologist, my team of OBGYNs, all the nurses, and they're just doing everything. They're splashing the iodine everywhere, they're cleaning, they're putting in the urinary catheter. You're awake for this. So I'm just lying there awake, being like, you know, I would feel kind of embarrassed, but I'm too nervous to feel embarrassed, so we're just gonna go with this. And then they tested me to see if I could feel sharp pain, and I couldn't. And that's when my OBGYN said, we're gonna get started. What you feel during the C-section itself is really just pressure, tugging and pulling and pushing, but nothing sharp. I felt a lot of that, the pulling and tugging and pressure. I swear, just 10 minutes in, I heard my OBGYN say, 1 big tug. And then that's when I felt a large tug and then this huge release of pressure from my abdomen. Because up until that point, baby girl was kicking up a storm and moving around and stuff. 5 seconds later, I heard her crying. And my husband and I, because my husband got to go in the operating room with me, he and I just looked at each other and we started crying because it had been such a journey to get here after 2 years of infertility treatments, a lot of physical and emotional turmoil and challenges. It just was crazy. It was just so crazy to hear her crying and to know that she finally is joining our family. Mei Mei is what I'll refer to her as. That's her nickname. It means little sister in Chinese. Mei Mei was taken to the infant warmer, stimulated for a few seconds, and then she was placed immediately on my chest for skin to skin, while the rest of the OBGYN team was busy kind of sewing me up. And everything was going really well up until they flipped my uterus out of my body to stitch it up. And that's when the nausea hit me so crazily. It was like an instant. And I was extremely nauseous and retching for about 10 minutes while they were sewing me up. I know that my anesthesiologist was pushing Zofran in for me, an anti-nausea medication, and I slowly felt better, but it wasn't until they had finished sewing and stitching up the uterus and it put it back in and were working on my outer layers that I finally started feeling better. And I was told that that's very common. all of this took maybe an hour. Then I was wheeled into the PACU for recovery. And that's when every 15 minutes, the nurse would come and do the fundal massage, which is when she would press really hard and massage my uterus in my belly. It actually really, really hurt. And this is supposed to help make sure that you're not hemorrhaging and to make sure that your uterus is firm and contracting, that it's not boggy, but it just really hurt. And so that's something just to give you a heads up for that might happen while you're in the recovery room. The first 2 days are pretty much a blur because I stayed in the hospital for 48 hours after my C-section. That first day, I could not even get out of bed. By the nighttime, the nurses did come and try to get me to stand up out of bed, but I was just in pain and my legs felt weak. My stomach, it really felt like everything in my stomach was going to fall out when I stood up. So I couldn't really stand. But by the second day, I was actually able to get out of bed and shuffle over to the bathroom and have the Foley catheter removed and use the restroom and do all of that kind of stuff. But that very first day, I just remember I was extremely itchy, and this is a common reaction to the long-acting anesthetic in the spinal medication, but I was itchy from my face down to my toes, and I was just scratching myself. I also had developed all these petechiae, these little burst blood vessels all over my thighs and my abdomen from them pulling off the surgical adhesive dressing. And so I was just itchy all over and dealing with, these rashes and things like that. But overall, it wasn't bad. My appetite came back. They were advancing my diet. So I had my surgery at 9:30. I was able to eat my sushi dinner by 7:30 p.m. that night. So I was pretty ravenously hungry by then, having not eaten for 24 hours. I devoured it. And sushi was something that I had been craving, so I was really happy to finally get it. After 2 days in the hospital, I was able to go home. This is after I demonstrated that I was able to urinate without a catheter, that I was able to walk, shuffle, really, and that my pain was controlled. So for the first, I would say 2 days, I was on scheduled pain medications around the clock every 3 hours, alternating Tylenol and ibuprofen. And I do recommend that for anyone going through a C-section. Just take the pain meds because it will allow you to be more mobile. I also was given the option of using narcotics if the pain got really bad, so I occasionally took those as well. After we came home, then I basically couldn't go up the stairs to my master bedroom. So I stayed in our guest room on the first floor. That was really helpful. And also my parents were both here and we have a nanny, and my husband is home this time for an extended leave. So I felt really supported. I had my parents to fully take care of my 4-year-old son and my husband, Matt, to help with that. And then I had a nanny who came a couple days later to help fully take care of Maymay and me. And then I could really take time to recover and not feel pressured to get back into the swing of things right away. I want to go over some tips for recovering from a C-section because when I posted this video on my social media, I got hundreds of comments from you telling me tips for how to recover. And I wrote them down, I took notes, I listened to you guys, and you all had the best recommendations. So I want to share some of those tips with all of you expecting mamas out there that hopefully this can help you too. The first is to try to move around and try to walk as quickly as possible. This may seem counterintuitive, but walking around does so much for you. It improves your vasculature, it moves your bowels so that you can actually go to the bathroom, and it helps to speed up your recovery. Of course, do this in moderation. Like, I'm not telling you to go run a marathon after you've had major abdominal surgery, but I am telling you to not just lie in bed for days and days because that will actually slow down your recovery and also increase your risk of developing blood clots in your legs. I tried to get up and moving a little bit at least every day. I tried to go for 10 laps around my house twice a day. And by the 5th day, I was able to go up and down the stairs, which boggles my mind that you can do that within a week of having abdominal surgery. So definitely moving around. And that leads me to tip 2, which is in order to move around, you have to be diligent about taking your pain medications. Like I mentioned, I was on Tylenol and ibuprofen and took the occasional narcotic if needed. I didn't really need it all that much. I want to say I took the narcotic for maybe 4 days, and then I was off of Tylenol and ibuprofen by 7 days. But that first week, I was pretty diligent with taking my pain meds every 3 hours so that I could walk around, so that I could breathe in deeply and not get atelectasis or a collapse of my lower lungs. I also wanted to make sure that I wasn't in so much pain that I couldn't carry my baby or breastfeed. It's really important to have good pain control, and if you don't have good pain control, please talk to your doctor because pain control is super important for your recovery. Okay, my third tip is to take stool softeners and get on a really good bowel regimen. I started taking a bowel regimen even a day before I had the surgery because, after you have abdominal surgery, that pretty much shocks your GI system. And so by moving and also by taking a good bowel regimen, you can help things to move along again. That first bowel movement postpartum is really scary for a lot of women. So I just urge you to talk to your provider about what to take in order to help your bowels move. I was taking Go Lightly every morning mixed in with my orange juice, as well as Senna. And for gas pains, I was taking simethicone. And this all started at the hospital itself because in the comments on my Instagram, a lot of women said that the gas pains were even worse than the surgical pain. So I was sure to stay on top of the simethicone as well. Tip: wearing an abdominal binder. So this is not even to help with the uterus shrinking faster. This is so that it didn't feel like my stomach contents were all going to fall out of my abdomen. My rectus abdominis muscles, your six-pack muscles, are completely stretched and pulled apart in pregnancy. And so after you give birth, there's nothing really holding the contents of your abdomen in as tightly. An abdominal binder was crucial to helping me get in and out of bed, walk around, and especially if you sneeze or cough or laugh, oh dear Lord, those actions are extremely painful after you've had a C-section. So having an abdominal binder was really helpful to stabilize my core and help me feel supported. The hospital actually provided me with an abdominal binder, but it was too large. So I will share the one that I got off of Amazon below. It's actually the same one I used as a belly band during pregnancy. Is to buy high-waisted underwear. There's some C-section friendly underwear that's extremely high-waisted that can support your belly because you're still going to look 3 months pregnant after you give birth. The high-waisted panties actually will go over, all the way over your C-section scar and whatever wound dressing you have on. And that's also really helpful as it doesn't irritate the wound. So shifting gears a little bit, I had posted this video sharing all the different things that you should pack in your hospital bag for a C-section. But now that I've actually been through it, I can tell you that you do not need all of these things and that the hospital actually has most, if not all, of the supplies that you need. In addition to your toiletries, a couple of things that I think would be helpful would be: one, a blanket. This wasn't for me. This was actually for my husband because the hospital blanket they provided for him was really cold. And so the least I could do was give him this comfy blanket. Two, remember to bring a comfortable robe. For me, this was one of the clutch things that I purchased off of Amazon that I really liked. I'll link it below. It feels like a sweatshirt material robe, but the inside is lined with fleece and it's really warm. For the first day and a half, I was just wearing a hospital gown, but the hospital gown was so large on me and it just wasn't very comfortable, especially with my skin issues. So I was happy to switch into my breastfeeding tank and a robe. You have to bring that many outfits, pretty much just 2 outfits, the one that you came in and then the one you're gonna go home in. And then I, of course, brought my robe. I didn't end up wearing like these cute pajama sets that I had because they were just impractical. I mean, you're still bleeding and you just need easy access for breastfeeding. So a breastfeeding tank or a gown was just the easiest for me. Extra long phone charger is definitely needed because oftentimes the outlets are behind the bed and it will need to circle all the way around to reach your bed. So that was important. Remember to bring one going home outfit for your baby if you're into that. I mean, otherwise the hospital does provide outfits for the baby, as well as our hospital provided a little Halo sleep swaddle, which was much easier to use than those other swaddles that you have to wrap and fuss with, the non-Velcro ones. I can never get those straight. We also did was bring a gift for Totori, for older brother, so that when he visited her in the hospital for the first time, we were able to give him a gift from her, saying that she's really excited to join the family and hopefully to give him a positive association with having a new little sister. So that's my birthing story and some C-section recovery tips, and I hope this was helpful for you, or if you have a friend who's expecting and contemplating having a C-section, please send this video to them. As usual, please let me know if there's any other topics you want me to cover. I'll be diving back into skincare soon, going over a breastfeeding safe skincare routine, and I'd love to hear from you. We have a lot of cool content coming out soon and some exciting projects in the works, so please do hit subscribe and we'll be in touch. See you next time.